important, 10 to 15%, this issue with endocrine related issues, side effects. Do we still worried about injury to the lung and injury to the colon? And, how do is it something that you can reliably predict? Can patient reliably can figure out they're having this, or this is some haphazard?
Well, so I mean, that's an important question. How can we predict or identify which patients are at higher risk of developing these side effects? Really critical question. A lot of people are looking at various assays and biomarkers to see if we can do that. In fact, there's some really impressive work that just came out of NYU looking at kind of proteomic analyses, right? And so there may be potential signatures to identify those who are at risk of these, what we call immune-mediated adverse events. But there's nothing that's ready for prime time. And so we're certainly worried about all of those side effects. And, I'll say when I treat patients with combination ipilimumab and nivolumab, where the risk of what we call a grade 3 or 4 side effects and bad side effect is over 50%, I'll watch them very closely, sometimes with weekly visits in the beginning, because, when we look at prior data, some of these side effects can be fatal, right?
Yeah.
And somewhere between 0.3, 0.6% of patients who are treated, this is older data, but between 0.3 and 0.6% had a fatal toxicity, right? And they frequently occurred early on. And we know that if we don't catch a side effect early, if we don't kind of act upon it, it becomes harder to treat.
Well, what do you look for? I mean, I think this is a really important point, right? Because, some of the dosing regimen is same basically. And everyone, they can go to some other medical oncologist, but what do you look for? Like, what do you look for in that patient to make sure, what question do you ask basically? And what do you tell your patient basically?
Yeah, so I think this sort of therapy has to be a very, very, very close partnership between the doctor and the nurse and the patient. And basically, I say we need to know if anything is off, and I need to know immediately, not 2 days later, not 4 days later. Colitis is a common side effect, so diarrhea.
Sure.
And I'm not waiting for frank, watery stools 10 times a day. I'm asking patients to let me know if they're feeling bloated, gassy, if they're going, a couple more times a day than normal, even if it's formed. So the patients need to let us know if anything is off.
No, that's really, really important.